repetitious activities. Too many reps, too much work for the muscle. It gets overloaded, causes trigger points and muscle spasm. Now, what I want you to think about is all the little movements that add up that you're doing many, many times. Because you gain more overload from the repetitions than the weight. So it could be side to side bending motion. It could be forward to back bending motion. Any motion where you're twisting, going side to side, or pivoting front to back, it's using those back muscles. Especially if you hold a position like this for a long time. Maybe you're reaching for things, organizing things at work. Maybe you're doing something around the house, certain chores. Maybe you're vacuuming and you're pivoted forward a little bit. That's going to overload these back muscles. Maybe you're twisting and doing something. Massage therapists, maybe you're constantly repositioning your body as you do elbow strokes. Maybe you're constantly leaning forward as you do your compressions. The main idea is that whether it's in your daily life, your job, or in the gym, you're doing too many repetitions and it's overloading the back muscles. So, how do we fix this? The number one thing that you want to do is get some soft tissue therapy on it. Basically, it's compression, it's massage, it's getting on a foam roller, it's getting a lacrosse ball on those back muscles, or a tennis ball, or a barbell. And putting pressure on it is going to make it feel very, very good. So especially when you have a trigger point, what you want to do is compress around the area until you feel like you found that one particular spot that's very sensitive. Then what you want to do to deactivate that trigger point is hold the compression on there for about 30 seconds and breathe deep into it. Now, a really good tip is to take deep breaths into your stomach and expand the rib cage and really think about expanding your body into that particular area that's very, very sensitive. Now, trigger points need a lot of repetition to deactivate because you're always using the muscles. You have to always calm them down with the trigger point therapy. So the recommendation is to do at least 5 minutes a day in 1 minute chunks. So you just want to get 5 sessions. You can do this every single hour. You can do this 10 times a day, where you find the muscle that's spasming or very sensitive to the touch, you apply pressure, and then you wait for 30 seconds. We call it ischemic pressure. Or you can do slow stroking massage in one direction, and you do about 15 to 20 slow strokes as you breathe. If you ever find yourself holding your breath, you're doing it wrong. You have to breathe. You have to let the muscle relax. So that's the number one thing that you can do to get those trigger points and those muscles to relax that are overloaded. Alright, so I wanted to jump over here and give some specific insights on how to do this. So first, you want to find the trigger point. To do that, you want to probe around with a more broad tool like a foam roller. Alright, so this one has little knobs on it that can actually deactivate, but a lot of people don't have this. It's called the Rumble Roller, by the way. Go buy it. But you want to find the really sensitive area. A normal muscle will feel very soft, but when you find the trigger point, it's gonna feel very tender and sensitive. So notice how I really put that thing everywhere. Roll left, roll right, roll on your side, get the whole lat, get the place between your rib cage and your pelvis. Once you find the place that's really sensitive, there might be a couple, get a more precise device, like a ball. Any kind of ball works, especially a lacrosse ball. Put it on the area that's really sensitive with a 7 out of 10 pressure and hold that ischemic pressure that we were talking about. Breathe deep into your rib cage and take your time. Do this frequently, guys. You can do this 10, 12, 15 times a day and be patient with it. You can't force a trigger point to relax. So just put in the frequency, breathe, relax. You'll feel the muscle release, and then you'll have a lot less pain. So that's how you release the trigger point with a foam roller and a ball. Go ahead and smash that like button if this video has helped you. Share this with a friend who also has aches and pains in their back. Subscribe so that you can continue to get videos on how to get out of pain, perform your best, and be healthy, heal naturally. And thank you guys for watching. I'll see you next time.